my channel. If you're new, my name is Jessica and I've been struggling with infertility for 9 years. So I was really nervous to get this test done because I've had several uterine biopsies and they were pretty painful, the ones that I've experienced in the past. So I was kind of nervous going into this, but I have to tell you, it was a breeze. I was expecting the worst because I did some research online and some people's experience, they said it was super painful. Some people said it was equal to what they had experienced when they had prior biopsies. So I was nervous going into this. But I have a few tips of what I did that may help you to get through this ERA test, and hopefully it won't be as bad, and hopefully your experience will be similar to my experience. The first thing that I did was I actually took the entire day off from work. I wanted to do that because a lot of the times I would do my biopsies, I would schedule for later in the day and do it after work, but I feel like that rushing around, coming home, getting freshened up, getting changed, trying to make it to the appointment on time, I feel like that caused a lot of stress, and stress does not help when you're in a painful situation. You want to be completely relaxed so that your body responds differently to pain. So I wanted to be relaxed. I didn't want to go into this stressed. So I took the whole day off from work, and what I did was I just woke up early. I had a light breakfast, I had my coffee, I read my Bible, I listened to my worship music, and I journaled my thoughts and just have a clear mind going into it. My appointment was in the midday. It was around 11:15, and they wanted me to take 800 ibuprofen 1 hour prior to the procedure to help with the pain. So I did that. But another thing I did was I asked if I could have volume for the appointment, just because I was very nervous about it and I wanted to be a little bit more relaxed. So my doctor did allow that. So you should ask if it's something that they would offer. They only gave me one volume pill, and I took it along with the ibuprofen, and I did it exactly an hour prior to the appointment. Then I showered, I got ready, and by the time I got dressed, I really started to feel very relaxed and a little woozy, and that's exactly what I wanted. And I needed to have someone drive me to the appointment because you cannot drive if you're taking that sort of medication. Yes, so I definitely asked for the volume, and I feel like that really helped the procedure, and it was really quick. It doesn't take very long. I would say it was about 10 minutes, but I was so worked up about this appointment, and I'm not sure why. I don't know if it's because I saw like other women say how terrible it was the most painful thing they ever had, so I was getting really nervous about it. The other thing I did was I had a light breakfast. I wanted to make sure I didn't have something very heavy because I wanted to take the medication and I wanted to get the full effect of the medication. Sometimes when you take those sorts of medications on a full stomach, you don't fully get that relaxed feeling that you're wanting. Another thing that I did was I brought my headphones into the room with me, which I never do, and I don't know why I never did that before, but I just put my headphones in, I put my worship music on, and I immediately started praying. As soon as I laid down on the table, I immediately started praying that this would pass, it would be simple, it would be easy, and that it wouldn't hurt. Surprisingly, it did not hurt. So basically they put the speculum like they would normally do for an exam. I'm not sure if they put a catheter in or not. I'm pretty sure I heard them say they were putting a catheter in, but again, I was in the zone, so I'm not exactly sure what they did. And then they just took a small sample, and they said they got enough of the tissue that they needed to do the test. They didn't have to go in a second time and get anything else, so they got everything on the first shot. And I didn't feel it. I really did not feel it. I don't even remember even feeling a pinch or not. And I don't know if that's because I was relaxed with the volume and taking the ibuprofen 1 hour prior, or if it was just because my mindset was in a different place. It could have been a combination of the both, but honestly, it was not bad at all, and it was over in less than what it seemed to be 5 minutes. Afterwards, I was good enough to go get something to eat. We went and we got breakfast afterwards, and I had my big breakfast then. But it was good. Basically, the reason why we wanted to proceed with this test was because I had a failed frozen embryo transfer in July, and I've had multiple complications. I've had endometriosis. I've had pelvic congestion syndrome. For the pelvic congestion syndrome, I had to have a uterine vein embolized, meaning that they had to, the vein was clogged, and they had to go in with a catheter and release that blockage, basically. So I've had that done. I've had my fallopian tubes removed, and I've also had a history of cysts. So we don't know if the embryo failed because it was just chromosomally abnormal. We never did pre-genetic testing on the embryos. We don't know if it was the embryo that failed. We don't know if it was something with the receptivity of the progesterone that I was on, or we don't know if it failed because of the lack of maybe blood supply, or the lack of the ability for the embryo to implant because of all my previous history. So that's why we went ahead and did this test. I feel like this is going to be one of the pieces to the puzzle that we're trying to figure out. I don't know. I kind of have a feeling that the receptivity was off, and we'll see. I'll get my results within 2 weeks, and I kind of feel that I'm going to fall into the pre-receptive category, which means that I need more progesterone. But that's just the feeling that I have. I don't know if it's actually true, but we'll find out within 2 weeks. So basically what we're doing now is I stopped all my medications. I'm no longer taking the estrogen pills or patches, and I'm no longer taking the progesterone injections. So I'm waiting for my cycle to start, which should start soon since I've stopped all the medications. And once I get my cycle, we start all over again. So we'll start with the pills and the patches. I'll go in for my baseline appointment, and then after the baseline appointment, we'll know when to start the progesterone. But by that time, we should have our results back, and we'll know if we need to tweak anything with the progesterone. So this test is specifically about the progesterone level. It does not affect any estrogen. So I can go ahead and start those medications, normal protocol like I've been doing, because it's not going to affect anything, is what my IVF nurse coordinator said. So basically I'm just waiting for day 1 of my cycle. I go in for my baseline on day 2 or day 3, depending on when my fertility clinic can get me in. And then after that, we just start the cycle all over again. So I'm kind of glad to be on a little bit of a break from medications right now. I was experiencing, with particularly the estrogen, which I did not experience last time, at least I don't feel that I did. I've been experiencing a lot of memory loss. I need to write everything down, and I kind of feel a little scatterbrained. I've noticed this especially at work. I've been having to put sticky notes everywhere. I need to make a grocery list, because if I don't, I'm forgetting something. I've been needing to make to-do lists very frequently. So I asked my doctor, and they did say it's normal, and he said it does get worse with pregnancy, so wish me luck. I do feel that this test is worth it. I wanted to talk about the cost. So there's my clinic does 2 separate fees. So the lab that's actually performing the analysis is Igenomics, and I think that's the common lab that's used with most of the fertility clinics in the US, because I've watched several other videos and they've all seemed to be going to the same lab, iGenomics. So your sample gets shipped there. Their cost is $795 for the test and the shipping cost. And then my cost for this cycle, the ultrasounds that I had to get done, the blood work that I had to get done, and the actual procedure itself, it was all bundled into one fee at my fertility clinic, and that was $1,455. So it was a total of about $2,300 from the two separate fees. So with the fee from my fertility clinic and the fee from the iGenomics lab. It is pricey, but I feel that it is worth it, especially in our case, since we did not test our embryos. It'll give us a peace of mind once we get these results back, because we can see, okay, if it was me, if it was the embryo, or, you know, we can have some sort of information. While we're on the subject of genetic testing, I kind of wish that we did do the genetic testing, especially at the time of our egg retrieval, because I had a different insurance at that point and they did cover the egg retrieval and I didn't have to pay very much out of pocket. But we were a little bit concerned. We were a little bit concerned with the cost of it, and I never followed up, and I never really, I don't know, I really thought that the first transfer was gonna work. I just always thought it was gonna work. So I didn't question, you know, I didn't go into further details. I only ever got an estimate of what it would cost. But I do feel like now in this stage, I feel like the genetic testing would have been very helpful, because it would have already ruled out the embryo not being chromosomally normal. So my advice is, if you could afford the genetic testing, and they're recommending that you for you to do a frozen embryo transfer, then do it if you can afford it, because now, if you're in my situation, I've had one failed transfer, I didn't do genetic testing, and now we're left with questions of why didn't it work, especially if you have an extensive history like I do. That would be my only, it's not like a huge regret, but I'm kind of kicking myself now, like we should have just put the money out and taken care of it in the beginning, and maybe our outcome would have been a little different, but it's all good. I'm still very hopeful, and I feel like after this test, I feel more confident going into the second embryo transfer. So we'll see what happens. So yeah, just keep us in your prayers and leave a comment down below. What was your experience with your ERA? Are you having one? Are you just interested in this video? Are you currently on the journey of doing IVF? Leave your comment below. I would love to talk to you guys. But thank you for watching. My next video will probably be my ERA results, and I also want to vlog our transfer day. So stay tuned for more videos. And again, thank you for watching.